Senna Lax, also known as Sennosides, is a medication used to treat constipation and to clean out the intestines before a bowel examination or surgery. It is classified as a stimulant laxative, which means it works by retaining water in the intestines, leading to movement of the intestines. The recommended daily dosage for adults is 17.2 milligrams per day, and it is best to take Senna Lax at bedtime or as directed by your doctor. Always consult with a healthcare professional before starting any new medication. To take Senna Lax, simply follow the directions from your doctor or the product package. If you're using the chewable tablets, make sure to chew them well before swallowing. If you're using the dissolving strips, let them dissolve on your tongue and then swallow. If you're using the liquid form, be sure to measure the dose carefully using a special measuring device. The dosage of Senna Lax is based on your age, medical condition, and how you respond to the treatment. It's important not to increase your dose or take it more often than directed. Also, it's not recommended to take this medication for more than 7 days unless directed by your doctor. It may take 6 to 12 hours for Senna Lax to cause a bowel movement. If your condition doesn't improve or gets worse, or if you experience bleeding from the rectum, be sure to consult your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience stomach/abdominal pain or cramping, nausea, diarrhea, or weakness, you should tell your doctor or pharmacist right away. This medication may cause your urine to turn reddish-brown, but this effect is harmless and will go away when you stop taking the medication. If your doctor has instructed you to use this medication, they have determined that the benefits outweigh the risks of side effects. Most people who use this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience persistent nausea, vomiting, or diarrhea, muscle cramps or weakness, irregular heartbeat, dizziness, decreased urination, or changes in mental/mood. While serious allergic reactions to this medication are rare, if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. Remember that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. Before taking Senna Lax, make sure to inform your doctor or pharmacist if you have any allergies to it or to Senna, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions. Also, let your doctor or pharmacist know your medical history, especially if you have appendicitis or symptoms of appendicitis, a sudden change in bowel habits lasting longer than 2 weeks, bleeding from the rectum, or intestinal blockage. If you are going to have surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are using chewable tablets or dissolving strips, be cautious if you have diabetes or any other condition that requires you to limit or avoid sugar in your diet. For pregnant women, it is not recommended to use Senna Lax for long periods during pregnancy. Consult your doctor for more details. This medication passes into breast milk, but is unlikely to harm a nursing infant. Be sure to consult your doctor before breastfeeding. And always remember to talk to your pharmacist for more information. When taking Senna Lax, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Senna Lax. As always, it's important to consult with a healthcare professional before starting any new medication. If you or someone you know has taken too much Senna Lax and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include persistent nausea, vomiting, or diarrhea, as well as severe stomach or abdominal pain. Make sure to keep all of your medical and lab appointments. In addition to taking Senna Lax, you can also make lifestyle changes to prevent or relieve constipation. This includes regular exercise, staying hydrated by drinking enough water, and maintaining a balanced diet with plenty of fiber-rich foods like bran, fresh fruits, and vegetables. It's always a good idea to talk to your doctor or pharmacist about any lifestyle changes that could help improve your condition. If you have been instructed by your doctor to take Senna Lax on a regular basis and you forget a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at the regular time. Don't take a double dose to make up for the missed one. When it comes to storing Senna Lax, it's important to follow the specific instructions provided by the brand you're using. Always keep medications out of reach of children and pets. Remember not to flush Senna Lax down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, be sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.